Go.
Clinical researchers, thank you very much for watching. Welcome back to the show. I've got here Christian, CRA Academy graduate. How's it going, Christian?
Good.
Omaha, Nebraska. Our first student ever from Nebraska.
Right.
Maybe my first interaction ever with anybody from Nebraska.
Really?
I don't know.
Okay.
Maybe. So, what's it like out there? Because you were in Maryland before.
Right.
There's much more of a research ecosystem in Maryland.
Right.
Okay, and the whole DC, the whole DMV area. Mm-hmm. But in Omaha, what do you have there? I mean, it's just pretty much universities, right? You have clinics?
Right, yeah, we do have clinics in Nebraska. I actually moved there because of school. I went there because of school.
You went to University of Nebraska?
I'm still there. Yeah.
Cornhusker, you're a Cornhusker.
Right, exactly.
There you go.
So that's what moved me there. But it's not bad. It's pretty nice out there.
Cool. I gotta go visit.
Yeah.
And then I gave you the clinical research directory, so you can search. You searched. How many did you find in Omaha?
I actually found 3. They're all not in Omaha, but there's some cities close to Omaha, like Lincoln.
Okay, so 3 in Nebraska total. 3 clinics.
3 clinics. Yeah.
That's good. That's good. So you want to be a coordinator. You have a background as a research assistant. Mm-hmm. You actually were a coordinator in Ghana.
In Ghana, yeah.
Can you tell us about that? You were doing clinical research in Ghana back for 5 years, from 03 to 08.
Right, exactly. When I was in school, I was in the University of Ghana.
Okay.
I was helping in the research department. I was there for a little bit, and after school, I was still there, and I was the few CRCs coordinators there working there, helping professors and all that.
I'm updating your CV as we speak, so interesting. What is the research like there compared to in the United States?
In terms of what,
just all around, like.
Most of the stuff are manually. We don't really have we have like ESOLs and stuff here. So those sort of things.
What about EDC? Was there EDC there? Paper CRF.
Right, kind of paper system, kind of thing. And
a lot of the world still uses paper CRFs in research.
Yeah.
Okay, so what yesterday you guys did a couple of things, and then first of all, what did you think of the academy?
I think it's great. I've learned a lot, and especially this week, this particular, I feel like I've learned a lot more than the 3 months that I've
That's good.
Yeah.
Good segue. So what did you learn this week that you're glad you came? So what did you learn this week that you wouldn't have known if you didn't come?
Well, almost everything. Just more of the stuff that we did was online, because you see physically, in person, interact with at the CRCs, site owners like you, yourself, me, too.
And you wanted to go in that route too.
Right, exactly.
When did you decide? When you came here?
Yeah, when I came here, I think I was talking, you and I.
And you're not the first.
Right.
We've had many students come here and say, hey, like they see what me and Chris are doing, and it's like, it's nothing fancy. I mean, it's not difficult to, I'll take that back. It's difficult to do this without knowing what you're doing, but it's not complicated.
Right.
So like they see it and they're like, hey, I think I can do this.
Exactly.
So you got that as well.
Yeah, I wasn't even thinking about that when I first came, but I think myself and David were talking. He told me that his long-term goal was to own a site.
Yeah, he told me that too.
Right. So I didn't really give it much thought. When I met with you,
would love to partner with you in Nebraska.
I'd love to do that.
So the roadmap for you, this video will be titled a study coordinator that wants to become a site owner or something like that.
Yeah, something like that.
Right? So we've set up a roadmap for you, right? Because you've done research coordinating in Ghana. Right. Then when you came to the U.S., you did some contracts and budgets for research companies, and then you were doing research assistant type of stuff, right? While you're going to school now, University of Nebraska. So the next goal for a lot of people who come from other countries as coordinators or even as CRAs, they come here, they want to do the same thing they did in their country, but the employers want to see U.S. experience. That's the problem. So now we've got you some. because since April you've been doing it with us.
Right.
And now the roadmap for you is coordinator.
Coordinator.
At one of those places you find in Nebraska.
Right.
And learn, and then start the clinic there.
Right. Gain some experience and then
Yeah.
start the clinic. Right.
Start a clinic there. And now we're going to do your video cover letter.
Okay.
But what? So yesterday when you did the IMV and the closeout visit, what did you? What do you have? What do you still, if anything, are you still struggling with, or something still unclear about any of the topics?
Actually, doing that yesterday actually made more sense. You know.
The reports?
It really helped. Made more sense.
Which one? Which report?
In fact, the closeout that we did kind of made more sense on how you close out on the study, and then what's the other one that we did?
The IMV for the e-source.
Right, the ESOS. It did a lot of things that came up and that we saw that we're discussing that came up and really made sense.
During the IMV?
Right.
Okay.
We discussed it, we're doing together. So.
Yeah.
And it kind of built more confidence in me. I feel more confident.
Good.
Than
So you know they're going to ask you in the interviews as a coordinator a lot of questions, right?
Right.
On your CV you have IBS study, which is the closeout visit one. You have the depression study, which is what you did yesterday, and you have a schizophrenia study, which is what you were doing in San Bernardino.
Right.
So they're going to see that, and they're going to ask you, tell us about, maybe some of the common assessments for depression. And you've got to know, okay? Or IBS, what are some of the common medications you noticed? So you got to know these things. Okay. You've got to go on Google Scholar, clinicaltrials.gov, look at these other studies with these indications.
Okay.
If you can't remember what you were doing this week, but try to take notes of what the assessments were, like the PANS, for example, right? Positive and negative symptoms of schizophrenia. So they're going to ask you these kind of things in the interviews, okay? Because it's a coordinator, so they're going to expect, patient interaction, which you now have twice, 2 days in a row you did it, so you can talk about that. You can talk about, if they ask you details about the study, you can tell them, right? So just make sure that you have those things in mind when you're interviewing.
Okay.
And then we're going to do the video cover letter as well right now. But yeah, I think you can, especially being in a place that's not so competitive.
Right, exactly.
And University of Nebraska, look into their research to see if they're... Have you done that yet or not yet?
I was just waiting on my CV.
Okay, so now you will.
Yeah.
Because you're a student there, they'll take you...
Exactly.
They want to hire the students.
Over
right?
somebody else.
Or at least even intern while you can.
Exactly. That's what I'm thinking, maybe.
Because right now you're majoring master in psychology.
Psychology, yeah. Right.
They do all kinds of psychology research studies too. You can do those.
Right. That's why I've been thinking about that. There are a few other places.
And keep expanding your CV, and I would say work in the field for at least a year or two, and then if you still feel like opening the site, to do it. That way you build a solid foundation.
So thinking the site should be like 2 years or something?
A year or two. Depends on how comfortable you are.
Okay.
Yeah? You don't want to do it right away.
Right away, yeah.
I don't think so. I think it's best to at least a year, put in a year as a coordinator, if not 2. Okay. Maybe the first year to learn
some stuff,
the concepts better, and then in the second year maybe to start saving some of the money.
Okay.
Because they usually give you an increase in pay the next year, so that second year to save a little something for the site, even though we'll teach you how to do it with very little expenses, which we've already talked about, finding a doctor who has an office, but there's still going to be costs involved. There's CLIA waivers, there's always some equipment that's missing, there's a website that you need to make, there's all these little things that up. There's an email you got to get, so you're going to need some money saved to do these kind of things too. Not a lot, not if you do it the right way. And in Nebraska you're going to do well. And if that's the roadmap you take, we would love to do it with you too.
Okay. So that in mind, waiting like a year or two, what do I need to be doing?
Coordinate.
just coordinator. I mean, so far as the site is concerned, just not do nothing, just concentrate.
Finding doctors in your area. Find physicians.
I was looking for some yesterday. I think I found one.
Yeah, I was supposed to look for you on LinkedIn on Tuesday, but I got busy. I didn't look. But they're there. Just put a physician, Omaha.
I think I found one that has been in PI for about 20 years.
Yeah. Set up a meeting.
And
We have flyers. We have flyers that we can send to you and say that it's the benefits of being a PI. And we have video. I have a webinar for physicians who are research naive.
Okay.
I can send you that too.
Sure.
And you're gonna actually have to watch those also, because when they're research naive, they're looking at you to give them knowledge on the topic. So you have to know that stuff also. We're gonna send you that as well.
Okay.
Very good. So you feel confident now?
Yeah, I do.
No issues? None. You're clear on everything?
For now, yeah.
Remember the assessments, the medications? Okay, not the investigational product. That's confidential, but the common medications for those indications and the common assessments.
Okay.
Common procedures, right? Get to know those things.
Okay.
That's just in case they ask. Right?
Alright.
And remember, review the modules. You have access to the CRA Academy files forever.
Okay.
You might have to change your password, but it's you don't lose access.
Okay. Sounds good.
Alright? So let's go do your video cover letter. You feel good about this?
Yeah, I feel good.
Now that you're warmed up, we'll go do it.
Yeah, let's do it.
Thank you, Christian. Thank you, everybody, for watching.
Thank you for watching.
Study coordinator, future site owner from Nebraska. Love that place. Never been, but I'm going.
All right.
If we partner, I'm going.
Sure.
All right. Talk to y'all later. Bye-bye.